PIX 11 Morning News.
All right, everybody, rolling into 9:30 right now. I appreciate you being here. I'm Dan Manarino.
And I'm Hazel Sanchez. Here's what we're working on.
Plus, we're bringing one of the top causes of kidney failures to the forefront. We're sitting down with a doctor and a patient to learn more about polycystic kidney disease in this morning's Health Matters. All right, everybody. So in today's Health Matters, one of the top causes of kidney failure is actually a genetic disorder called polycystic kidney disease.
So the disease affects more than 500,000 people across the country. And even though there's not a cure, there is a lot of hope. So joining us this morning is Dr. Heedeok Han, the director of Polycystic Kidney Disease Center at Columbia University, Irving Medical Center. And he is joined by patient Abby Giller. So good morning to both of you. Thanks so much for being here.
Good morning.
Hey,
Thank
good morning.
you.
Good morning.
Thank you for having us.
So Dr. first explain to us what polycystic kidney disease is, or PKD.
Yeah, so polycystic kidney disease, as you noted, is a genetic disorder that causes cysts in the kidneys to slowly grow over time and ultimately lead to kidney failure. It is, as you noted, one of the leading causes of kidney failure in America, and it actually does affect around 600,000 individuals in America. It can cause high blood pressure, it can cause pain and discomfort as the cysts grow, and when the cysts actually rupture, it can cause bleeding in the urine, and it can actually cause cyst infection as well.
Okay,
Wow.
So Abby, you are one of those 600,000, right?
Yes,
you
I am.
You call it PKD. And so does it run in your family? When did you start noticing some symptoms?
So it does run in my family.
Okay.
I actually got tested because my mother was diagnosed with PKD and was very fortunate and lucky to have a kidney transplant.
Yeah.
So I got tested, and about 7 years ago was officially diagnosed.
Were there
with-
symptoms or signs?
Not so much at my young age. It
Yeah.
kind of gradually goes over time. I didn't have high blood pressure yet, but kind of just checking in on my kidneys and making sure that I'm drinking a lot of water and kind of taking care of my body
Right.
to make sure that nothing progresses.
Okay, I mean, you had a history of it in your
Yes.
family, but not everybody does. So are there some people, though, that are predisposed to have this disease?
Yeah, so since it's a genetic condition, polycystic kidney disease doesn't have a natural predilection or bias towards gender or race, but there have been some healthcare disparities that have been reported. As you noted, and as she said, it's a very slowly progressive disease. So a lot of times it's not diagnosed until adulthood. In fact, it's probably diagnosed around age 30, between age 30 to 50.
What are some of the symptoms that people should look out for?
Yeah, so some of the symptoms that we tell our patients to look out for, even before screening, if they have a family history of polycystic kidney disease, is to start checking blood pressure at an earlier age, because patients are more likely to develop high blood pressure at an earlier age than the general population.
And you can pass it down, right, to future generations. So obviously you wanted to be a mom, and you knew that you were going to be tested for this. So how did you ensure that you would not pass it down to your daughter?
So my nephrologist actually told me that there was something called PGTM testing, which is genetic testing through the IVF process. So I would go through IVF and then get a special genetic test for the PKD gene, and that way we could choose embryos that did not have the PKD gene, effectively eliminating it now from my line of family. And I had no idea that this was even possible until my nephrologist brought it up to me, and it's really been a game changer.
Yeah.
Have you had children?
Yes, I have a beautiful daughter. She is 19 months old. Her name is Florence. And I'm very grateful that the process worked. And I was put in touch with an organization called PKD Free Alliance, which also helped with cost for the IVF. As many people know, it's very expensive. And PGTM testing is like a separate cost on top of the IVF. So they were able to help me with some of the money to be able to make my beautiful PKD free daughter.
That's wonderful.
Yeah.
But is there a cure on the horizon anywhere?
Yeah, so at this time, there's only one FDA-approved drug that actually aims to slow down the progression but not cure the disease. However, there are new drugs that are being developed that are targeting much more upstream, actually targeting the protein that is the cause of the disease.
Yeah.
So we're very hopeful for that. But stories like Abby's, I think, really gives us hope. And in fact, I've been working with PKD Free Alliance since, I believe, September 2023. I've seen them grow tremendously.
Yeah.
You know, they've supported over 100 families, over 22 PKD free babies they've been supporting. But I remember this one talk. I did many talks with them, and it was a talk at New York City with the PKD Foundation New York City community. And at the end of the talk, there was a Q&A session. At the end of Q&A session, one of the patients actually expressed gratitude towards PKD Free Alliance and said her daughter went through and worked with PKD Free Alliance. And that person is actually Abby.
Yeah.
So I just learned of this yesterday.
Yeah, my mom is a big part of the organization as a whole. So we're all just coming together. Yeah,
Full circle moment.
Yes.
Absolutely.
Dr. Han, Abby, thank you so much for being here.
Thank you
Appreciate your
for
time. Okay.
Absolutely. Thanks for having us.
Thank you for having us.